Hi, everyone. My name is Chanel Hudson. I'm the Vice President for Government Affairs and Public Policy on the National NSSLHA Executive Council. Today, I'm so excited to be joined by Arynn Byrd, the current chair of the ASHA GAPP board and a school-based speech-language pathologist. We're here to discuss advocacy in the field of CSD and to explore ways we can make a meaningful impact. Thank you for joining us, Arynn.
Thank you so much for having me. I'm honored to be here.
Thank you so much. All right, so we're going to jump right in. Let's start with your background. Can you tell us a little bit about your journey? How did you become interested in advocacy and public policy in the field of CSD?
That is a great question. I will say my interest in public policy for CSD kind of started a little bit later. So
Mhm.
I'm originally from Atlanta, Georgia. I got my undergraduate and master's from University of Georgia. But then I moved to Washington, D.C. to pursue my PhD. And I think being in DC, being around so many policymakers, I finally got a better understanding of how policy works, how it's made. And I think that's when it dawned on me that oftentimes some people who are making policies don't always have the experience of being in that role or the experience of being in that setting. And so that a lot of policies that were being made for hearing and speech professionals were made by people who may not actually have experience or background in our field. And so when I was listening to colleagues say they were frustrated with, how much we were being paid or frustrated with this new policy that just got implemented at their local school, I started to realize that maybe there is a space and a need for us to get involved in making sure that we're at the table shaping the narrative around the policies that involve us. So it was really moving to DC where I had that light bulb moment. Um,
Mhm.
and because I had that moment, I actually volunteered for a campaign in DC. It was kind of crazy. It was my first time knocking
Yep.
on doors for someone, really kind of pitching and understanding like how this person may work on my behalf. And then
Mhm.
I saw that there was an opportunity and that ASHA had a government and public policy board and that they had an early career professional position. And so I felt like that would be a really good opportunity to take my interest in
Mhm.
policy and just get a better understanding of how our organization is advocating for policies that directly impact us. So, kind of a late journey, but that's how I got here.
That's so awesome. Thank you for sharing that. And better late than never. I love that.
Absolutely.
Yeah, I love that you mentioned DC. I know the Gap board. We just had our summer visit there, and we visited the Hill, and I thought it was a great experience. Something new for me, but I hope to do more of it in the future. So, thank you for sharing.
No problem.
So, from your perspective, what do you think are some key policy issues or challenges that the Gap board is currently focused on? And then, how do you think these issues impact day-to-day workers, like speech language pathologists and audiologists?
Yeah, I would say one of the great things about the GAP board is that we are a group of volunteer professionals who are coming from a lot of different sides of the field. So we have audiologists, we have
Mhm.
we have speech pathologists, we have a public member. And so what this means is that we really end up being interested and focused on a lot of issues that may be impacting professionals. And
Mhm.
that's really our goal. Our goal is to gather lots of information either from surveys, from talking to colleagues, from live CEO chats to really try to figure out what are the things that are impacting members. And then, as you saw this summer, we really spent a lot of time having conversation about what are maybe some of the key issues that we can address on a national level, and then what are other issues that we can support our state and local associations in addressing. So I feel like it's very hard for us to really focus on one kind of
Mhm.
area because there's so many things that really affect us. But I know we are always thinking about workforce issues,
Mhm.
such as making sure we have enough SLPs or audiologists to actually treat our clients, our students that we're seeing. I know we're always focused on payment, ensuring
Mhm.
that we're getting reimbursed for the services that we're providing. And I know we're always just thinking about general healthcare issues. So how are we interacting with, other professions
Mhm.
who may also see similar clients at us? How are we making sure that we're collaborating in ways that are meaningful while also protecting our scope? So lots of things we're interested on, but they usually kind of fall in those three-ish buckets at times.
Yeah, there's just so many things happening all the time. I know.
Yes. And
I am,
ever changing, always
yeah.
changing too.
So it's really up to us to kind of keep up and make sure we're doing what needs to be done. So just to piggyback off that, I know we keep mentioning the ASHA GAPP board. Some people might not even know what that is. So can you just explain what the ASHA GAPP board does and why it's crucial for students to understand advocacy and public policy within our field?
Yes. So the ASHA GAPP board, it stands for the Government Affairs and Public Policy Board. And our charge really is to develop the association's annual public policy agenda. So this is a document that we as members put together based off of feedback from the larger membership. And then we work with ASHA staff to help advocate for those issues, whether it's in DC, on the Hill, or again, just supporting our local state associations or the state associations and the things that they're advocating for. And then we also really work on trying to make sure that the public policy agenda and the advocacy things that we're working on are actually communicated to the
Mhm.
membership at large. So whether that's, thinking of ideas for Instagram posts or just talking with colleagues and making them aware that we have a public policy agenda.
Mhm.
So I would say it's really just volunteers from lots of different backgrounds coming together to make sure
Yeah.
that we're capturing all the concerns of the membership. I think the second part of your question was, how can people get involved in advocacy?
Mhm.
And I think the first thing to think about is that it may be easier than you think. Like, I think I learned that the ASHA website has a place where you can go and look at a list of issues that may be interested to you, and you can actually email your senator, you can
Mhm.
email your congress member. And I've been emailing mine so much that like now they send me newsletters about what's happening in the state.
Yeah.
But again, that just starts opening that door for me to be informed about what's happening in my local community, but also just a very easy way to advocate, sending those emails, making sure that they know that there is a speech pathologist who's concerned about Medicaid or Medicare cuts. So I think just knowing that the ASHA website has a lot of different resources, the ASHA Advocate has a lot of different resources, but I also would suggest starting with your state associations. They're
Mhm.
oftentimes the group of people who are going to be advocating the loudest and being able to make sure that you're getting change that you'll actually be able to feel in your state. A lot of the concerns that we have, like caseloads or salary increases, those are things that can't always be accomplished on the national level, but
Okay.
can be accomplished on the state and local level. So getting involved with, the Georgia Association for Speech in, pathologists and audiologists, or the Washington, D.C. Association, just starting with that local group and seeing what they're working on and seeing
Mhm.
how you can get in and help amplify those issues as well.
Yeah, I totally agree. And I know advocacy can seem overwhelming when you first look at it. You're like, whoa, 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 that's too much. I can't do that. But it's definitely a team effort, and it takes many hands to make light work. So thank you for sharing that. Um, my next question will be just what are some common misconceptions about advocacy, especially in our field, and how can we help students and professionals make advocacy a part of their daily routine?
Yeah, I think the biggest misconception, and I'll speak for myself, is that advocacy moves fast. That if I
Hmm.
send my one email or I tell this person this issue one time, that it's just going to happen.
Right.
And what I've learned over time is that advocacy is a slow moving game, and the squeaky, wheel often gets the grease, and the people who are willing to band together and be the loudest are often willing to get the results. So I think I had to remind myself that it can't just be one instance of advocacy or one touch point. I have to follow up with people. Maybe I have to call my congress member. Maybe, if the Hill is open, I just have to show up and see if I can get a meeting. Just trying to remember that it just takes a lot of touch points. And I don't think I realized that just because I want to change now, I may not actually see that change until 5 years from now. I think the other misconception I had is that advocacy is something else that people do for me. And I
Mm-hmm.
think it took me realizing that if I want something done, I'm probably going to have to do it myself. or work with others to get it accomplished. Because again, if we're thinking about people who are sometimes making the policies, they may
Mhm.
not have ever, been in the audiology clinic, or they may have never, done research on hearing and speech sciences. So they're not coming with the same knowledge and stories and lived experiences. And when we bring those to policymakers, oftentimes we're bringing information and knowledge that can be infused
Mhm.
to help maybe have them support the issues that we're concerned about. So I think just remembering that every day I advocate for my clients, I'm already an advocate. I have to just transfer that to advocating for the profession and not just for my clients in my, immediate setting.
Yeah, definitely. I agree. Lots of repetition, lots of being persistent. That's really the only way
Yeah.
you're going to see
And those are
this.
things we're good at. We do with our
Yeah.
kids all the time. If I want a kid to say the S sound, we're
Mhm.
repeating and drilling and we're coming back to it over and over.
Exactly.
And honestly, sometimes advocacy is definitely the same way.
Transferring those same skills.
Yes.
Thank you so much for that answer. So, for the next question, I want to know, how do you see the role of advocacy evolving for students and what we can do to prepare ourselves for these challenges in the future?
Yeah, well, I think the great thing is I feel like there are more conversations about just policy in general among students. I think there's a greater resource to information and knowledge. And I think social media I've seen be one of the biggest tools for advocacy, just having access to more grassroots movement because you can get a larger number of people together. And so I think the thing that I'm most excited about is seeing how students who are thinking about policy way earlier than I was in their careers are able to like mobilize different tools like social media or creative campaigns to really get our message out and to really center like our work and our clients and what we do. So I personally think that while social media sometimes isn't always helpful in the goal of advocacy and in the goal of mobilizing students, I think that's going to be something that's really exciting as we keep, looking towards the future.
Yeah, I can totally agree with that. As someone who's on her phone more hours than I should be. Um, yeah, trying to use that in a beneficial way and staying up to
Yeah.
date and seeing what's happening. Hey, thank you so much. I really enjoyed your answers and hearing you and sitting here and chatting with you. So, before we wrap up, what is one final piece of advice or call to action you'd like to share with students who are listening today?
Yes, I think my call to advice is to know that you are already an advocate. Just circling back to something I said before, we already advocate for ourselves in classes. So, if you have a concern or a question, you ask your teacher. That's advocacy right there. You are going to be advocates for your clients, whether that's advocating to parents or advocating to insurance. So, advocacy is something that's already embedded naturally in our profession. And it's not something you have to be afraid of. A lot of the skills that we use for the clinical setting transfer and can be
Mhm.
transferable to advocating for our profession on the local, on the state, or on the federal level. So just know that you already have the skills that you need. And if you have questions or if you are curious more about advocacy, again, ASHA has a ton of resources. They have an ASHA advocate, but also just remembering you can reach out to NSSLHA, you can reach out to your state associations to find those ways to get involved. And the earlier you get involved, the more it'll feel natural and the more you'll find yourself being a part of the change that you want to see in our field.
Yeah, I agree 100%. Thank you so much, Erin, for sharing your insights with us today. Advocacy is such a vital part of what we do, and it's inspiring to hear early career professionals like yourself are leading the change. To our listeners, I encourage you to get involved, stay informed, and take action. Together, we can shape the future of our field. Thank you for tuning in, and thanks for coming in, Erin.
Thanks for having me.